3, 2, 1, go.
Good afternoon. I'd like to welcome you to this Plymouth COVID-19 update. We do a daily update. Today is April 3rd, and this is our 16th presentation. I'm Steve Triffletti, your Plymouth Town Moderator, and we'll be here each day, Monday through Saturday at noon for this update. This forum is brought to you live by PAC TV on Comcast, channels 13 and 15, and Verizon, channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions today during the forum, you can email us your questions to plymouthinfo@pactv.org. And these forums can be replayed at pactv.org/Plymouth. Today's participants who will be joining Ken Tavares and Matt Muratore will be Barry Potvin. He is from the Plymouth Board of Health. Also, Dr. Christopher Campbell, who is an assistant superintendent for the Plymouth Public Schools. Lawrence Pizer, the Plymouth Town Clerk, and also Amy Naples, the executive director for the Plymouth Area Chamber of Commerce. And now we're going to move forward as we do each day, and we'll begin with the opening message from Kenneth Tavares, chair of the Plymouth Board of Selectmen. Welcome, Ken.
Thank you, Steve, and good afternoon to everyone. I have a few things that we would like to pass on to the community that is being worked on by the Town Manager's Office and the Board of Selectmen. The first, as you have probably heard by now, that we are joining the state in closing a couple of our beaches. Plymouth Beach. I'll let the cuckoo clock go.
Ken, you need to unmute.
There
you go. Thank you.
That our community, use common sense and adhere to what the governor is asking as much as possible. We are pleased to know that House Bill 4598 has been passed. There are a number of recommendations that may benefit our citizens and the community as a whole. Over the weekend, we will be working on reviewing the bill and seeing what Plymouth can take advantage of. There's been continued questions about the town meeting books. I can tell you that we want to get them out as soon as possible, but we have to do it in a safe manner, and that is being explored. So hopefully we'll be able to get them out as soon as all the details are ironed. The other thing is that I want to talk about is parking. The Plymouth Growth and Development Corporation, known as Park Plymouth, announced yesterday that the 2020 paid parking season in Plymouth, scheduled to begin on April 1st, has been suspended until May 4th, 2020. During that time, the Park Plymouth office located at Court Street will be closed, and the enforcement of parking regulations in the downtown areas will be relaxed. This, of course, does not apply to handicap parking or those areas that are cordoned off for public safety. Also, the town manager informed the board today that we are now supplying 190 meals on a daily basis. The program is very successful because of the volunteers that deliver these meals and those that make it on a daily basis. Our hat goes off to these folks. They're doing an outstanding job. In anticipation of supplies dwindling a little bit, the town manager is asking that if anyone knows a source or has a source of a mass, that would be extremely helpful to know that, so that we can make sure that we can continue this program and have masks available. If you have any information, you can email it to Emma Riggy at townhall.plymouth.masks.us, and we will follow up on any leads that you're able to give us. Those are the updates for the time being. Thank you.
Thank you, and that is Kenneth Tavares. He is chair of the Plymouth Board of Selectmen. You can send your questions to plymouthinfo@pactv.org. These forums are designed to provide you with verified information from official sources. And joining us next, an official source from the Plymouth Public Schools would be our own Dr. Christopher Campbell, the Assistant Superintendent. Welcome, Chris.
Thank you, Steve. Thank you for having me. So I just want to take a moment to share with the community what we've been doing since this closure and provide some kind of guidance and clarity on things. But first, I just want to say that I hope that all of our families are staying safe and doing the best they can during what were undoubtedly the most unprecedented times in history, for our living history at least. I've been thinking so much about our families, our teachers, our first responders, our healthcare workers, and truly honored to live in this community first, and the collective good and goodwill and compassion of so many. So thank you to everybody, thinking a lot about you. So we've been monitoring the situation at the district since around February 20th, when our high schoolers returned from a student exchange trip to Milan. Really losing track of the days, but it was shortly after then that we began having conversations as a central office team as how we could handle certain things within school when we're in session, and what we would do if we needed to close short-term or long-term, like we are now experiencing. We were involved in weekly, if not daily, conversations and conference calls with the Department of Public Health, Department of Education, other state and local officials to use their guidance to shape the decisions that we've been making. Seems like a long time ago, but on March 11th, the guidance provided by the Department of Education and DPH at that time was that they were not recommending school closures unless local health departments felt it was warranted. Many of our colleagues, however, in the Metro Boston area were finding themselves closing school for 2 or more weeks at that point. So at that point, the commissioner was explaining to districts that online learning would not be considered school time, and districts were not approved by the Department of Education for remote learning. And that was on the 11th. So on March 13th, a couple days later, we, along with a lot of districts in the greater South Shore area, decided that we needed to close school for 2 weeks. Where there's a lot of evidence that we felt that we needed to do this for the safety of our community and our families. A few days later, the governor closed schools down for 3 weeks, which has since been extended to at least May 4th, at this point. Prior to our initial closure, we were referring to what we call phase 1. We started building a website, which can be found on our district website right now, full of all kinds of learning opportunities broken down by grade level and discipline. We've also provided a page for tech support and began deploying Chromebooks across the district, which have surpassed at this point about 700 to date, I believe. Our building principals continue to outreach to families and make arrangements for pickup of machines and Chromebooks if they need them. And we're doing that on a one-to-one basis still. We've provided numerous resources for mental health support, contact information for our students through guidance, our school departments, and all kinds of things, which can be found on our website. So that was as of March 13th when we closed. Since then, as you all know, the guidance has changed and we've extended that closure. So remote learning is now going to change for us. So just last week during our conference call with the Department of Education on the 27th of March, so it hasn't been that long, Commissioner Riley instructed districts to prepare for remote learning with students. So keep in mind, prior to that, we were instructed not to provide remote learning, but if we were closed, to provide some opportunities because it would not count as online learning. But now, given the circumstances and the extended closure, we are moving forward with what we're calling phase 2. The commissioner has also stressed to us that these opportunities should not exceed more than 3 hours a day per student. And specifically because, as you all know, we all know that families are trying to balance both working from home. Essential employees are out for 60, 70 hours a day trying to balance home and family life. So we're trying to be very mindful, and the commissioner was very mindful of that as well. So since last week, we've been building a completely separate website behind the scenes, which we're going to release Tuesday to families. So in addition to the resources that I mentioned before, we're going to be providing specific office hours for teachers, specialists, administrators, that we'll post on our website for immediate access to those individuals, for families and students, as well as our ongoing regular communications and outreach through email and phone. Teachers will be providing weekly lesson plans, which will be posted on the website, that will be organized by grade level at the elementary level and departments at the secondary schools. This will be inclusive of all teachers and all programs in our school. I just want to stress that. We're also providing additional support pages for our most vulnerable students, our English language learners, mental health supports, additional resources for families and students. And we've also constructed tech support pages to assist families and our staff with online learning environments, supports for our teachers to build videos to put up on the website for families and for students. So, I'm walking through this website on Monday night with our school committee for the public, so they'll get an initial public viewing of what this website looks like. Again, we're building it in 1 week, and it's pretty tremendous how it looks so far, and it's going to be fantastic. And you know, our primary concern is to support and engage all families, so we're going to be available, you know, quite significantly in terms of connecting with our families. So it's important to note, though, and I want to stress this to everyone who may be watching, that we're moving deliberately slow during this new phase. We're purposely designing this with flexibility in mind, trying to consider the unique circumstances that many of our families and our students, as well as our teachers, continue to have while they teach or work from home, many of them with young children themselves who are also trying to learn at home. So we're trying to be very mindful of that and deliberate. I sent a communication out to all our families yesterday. We'll continue to communicate over the course of this week, and we'll be available, you know, around the clock administratively to support our families. So, you know, what does online learning look like? You know, we're not built for we're not an online institution, but we're creating an online learning environment. So we're going to be providing a lot of what we call synchronous, which are real-time opportunities, and synchronous, and then asynchronous, which are opportunities for students to engage with teachers through videos and other things that they'll be posting. So some teachers will provide specific times and they'll be available online, while others will choose to record themselves and share that with their students. It's important to note, though, this is important for families to know, that we're not mandating students to log on at all at specific times with specific teachers. We realize that we cannot expect that or expect families to manage that given the unique circumstances that they have in their homes. We are providing these opportunities. We want to continue with education, and this will continue to live on this website so that we can support these students and the families given their unique circumstances at home. Another thing that I want to mention, which is probably going to be a concern or question for people, is April break. We have an April break, as you all know, in our calendar that's published each year. These are still considered non-school days. So during our call with the Commissioner of Education, we've been instructed that schools will not make up days missed due to the public health emergencies. There's no specific guidance as of last Thursday regarding using previously scheduled vacation days. So these days are still considered off. We've been instructed by the Department of Ed to add 5 weather-related days to the end of the calendar. So right now, our last day of school is June 25th, but we're going to continue during that week of April 20th, excuse me, to provide tremendous support and opportunities through our website for students on our schools during that week. Our teachers have been doing an amazing job connecting with their students during this closure already, even before this phase 2, providing opportunities to learn and connect. Many of them have independently been supporting children through Google Classroom, Google Chats, video opportunities. So we're just so proud of the work that our teachers have already done and ready for the next phase of this. I just want to stress that families are having access difficulties, barriers, engaging with technology. You know, we're trying to do outreach over this week and last week as much as physically possible to get devices and connectivity in the hands of our families. And we've done an amazing job, as I said, over 700 devices. but you still may be having difficulty, reach out to us at any time. We will be providing support, monitoring activity of our students, and our outreach efforts are going to be intense during this closure. I can guarantee you that. We have a system and protocol in place, and we're ready for that. So I'm really excited about that, and we're ready to support our families, as much as we possibly can to make sure that they're getting what they need and the support that they need. So that's in terms of the education, Steve, and I'm happy to talk about anything else that we're doing in terms of how we're providing food support to our families, and but I'll just turn it back to you.
Thank you. That is Dr. Christopher Campbell. He is the Assistant Superintendent from the Plymouth Public Schools. And as you've heard with his explanation, things are changing. It's fluid. And one of the reasons why we've been doing so many updates on a daily basis is because what was planned a few weeks ago has changed. And you heard from Dr. Campbell. But also, this forum is to show that we're connected, that officials on the town side are connected with officials on the school side. We're connected at the state level with our legislators. Tomorrow we'll have a representative from Congressman Keaton's office, because we're also connected at the federal level. And we're trying to coordinate the information to you so that you'll have accurate, up-to-the-date information as it affects Plymouth. And now we're going to go to our town clerk, Lawrence Pizer. We welcome him back again to talk about elections. Welcome, Larry.
Thank you, Steve. We'll start with election, talk about a few other things. Before we get to elections, I think that everyone knows that the town meeting has been postponed as of now until May 30th. So let's put that one there. I know that there are town meeting members who are getting excited about getting their books to prepare for town meeting, but there's some extra time. As far as the town election is concerned, I am going to recommend to the Board of Selectmen that the town election be postponed until June 20th. There is a lot of work in the town clerk's office to prepare for an election. And since the town clerk's office hasn't been available to staff, it's the sort of thing that is going to take a great deal of time once we get back, even if it's on May 4th. A lot of people to be registered who have been registering online and by mail, a lot of people who have sent in absentee ballots, a lot of people who have made requests for absentee ballots. As far as the decision by the select board, in case anyone has any questions, when you postpone a town election, the people who are in office whose terms would otherwise end extend until the town election. So it's an approximate month of extended terms. And the State Ethics Commission has already issued an opinion that says that as long as selectmen, and that includes Mr. Mahoney and Ms. Cavaco, whose terms are up, as long as they're willing to say that they are going to make this vote for the benefit of the people of Plymouth, they are eligible to vote. It is not a conflict of interest. So that we'll put that one right on the table. As of now, the state election for state senator is still scheduled for May 19th, but that's one of those please stay tuned matters. I am mystified if my staff is not admitted to town hall before May 4th, how we would get all of the absentee and early ballots out in time for that election. So we'll see if the state Senate decides to move that election as well. On a few other matters that have come up for the clerk's office, there are some things that we are working on and will be able to do better. In particular, the IT department, information technology, has said that it might be possible for them to provide one of the used printers so that I can take it home. And if that's the case, we will be able to produce certified copies for death certificates and for birth certificates. Right now, those are on hold, and we know people need them for various tasks. That also includes marriage certificates. Speaking of marriages, there are people who are asking, they would like to plan to get married. Right now, we simply cannot take intentions. Intentions are the application for a marriage. It is required that the clerk or a member of the clerk's staff and those two people be present at the same place at the same time. And certainly that's not advisable at present. Other matters seem a little bit more obvious. Dog licenses and clamming licenses. As far as dog licenses are concerned, we do have a small number of dog licenses that were sent in before we left. If you haven't yet applied for your dog license, we'd recommend that you do that online. We will get to that when we get back, but it's not something we can deal with now. As far as clamming permits are concerned, same thing, except if you have a question about clamming, that's a matter for the harbor master. I think that takes care of it. Thank you, Steve.
Thank you. That's Lawrence Pizer. He is the Plymouth Town Clerk. He and the other members of the panel will be joining us for our question and answer portion shortly following the initial presentations. You can send your questions to plymouthinfo@pactv.org. And once again, we now welcome Dr. Barry Potvin. He is a member of the Plymouth Board of Health. Welcome, Barry.
Yes, thank you, Steve. It's good to be here again. I just want to give some updates and some information. One thing I was asked to do was to let everybody know that you can sign up for a text-based update notification system. And to do that, you send COVIDMA to 888-777, and you will be able to get the updates from that. Another thing that I wanted to bring up was that the homeless population here in Plymouth, of course, is extremely vulnerable, and a lot of people are very concerned about them. Their seasonal shelter is scheduled to close on April 4th, and they certainly could use, if they could possibly get it, donations. So if you would go to the websites for any of these homeless shelter organizations, there's 2 of them in Plymouth, you'll find it's very easy to put donations online to those organizations. One other thing I was asked to make mention of was the term social distancing. Don't be confused by that term. It does not mean social disconnecting. And so when you talk about that, you think about what we can now do that we could never do before because of all of the newest systems like Zoom. And you can keep in touch with people also using video. Most people now, some people now think that it really should be called physical distancing, and the term social should be reserved for a term also accompanying solidarity. We're not going to change that, but everyone should be clear that when you think about social distancing, you need to maintain contact with people as best as you can. Another couple of mentions about beach closings. Everyone already heard probably about what's going on with beach closings here in Plymouth. The state, however, has decided that they would close the parking areas in all state beaches, but the beaches themselves, the state-run ones, are open. And you should also not think that this is some kind of new thing that's just been done only in Massachusetts and Plymouth. It's also been done extensively in other coastal states in New England, including New Hampshire, Rhode Island, and Maine. So that's been going on for a little while. Finally, and I'd like to mention something about Governor Baker's update yesterday. There were some fairly scary statistics in that in terms of number of cases. And a lot of people were probably very worried about what they heard. This is usually done by computer modeling systems, which Governor Baker talked about. But there's also some very positive news that came out of that update that the governor gave yesterday. Among them, there was Massachusetts being the 3rd largest tester in the country after only New York and Washington. He mentioned that the peak of cases, new cases for COVID-19 would likely occur sometime between the 10th and the 20th of April, after which hopefully the number of new cases will gradually decline. And he also mentioned, and this made me feel much more hopeful, that they expect something like a 1.5% mortality rate in Massachusetts. Sounds bad, but this is actually a lot better than many other states that didn't put some of these measures into effect as soon as Massachusetts did. The last thing to mention, there's been some questions about grocery stores, and this will bring me also to a discussion about masks and gloves. You should know that at grocery stores, there is now controlled access, and at least at Market Basket, and I found out today from our Director of Public Health, also at Shaw's, they are restricting the number of people that can enter grocery stores at one time. There's only one entrance to each store. When you go in, you will find one of the workers there will be present and will help you disinfect the handles of the grocery carts before you enter. Other people will be waiting outside, and there's actually markers on the walkway outside of the stores that will keep you separated by 6 feet as you wait to get in. Don't be intimidated by that. The lines apparently move quite quickly, and you'll be able to do that quite well. When you go in, you'll probably find, as we have all probably found, there will be a few people wearing masks, and there'll be many more wearing gloves. The masks, you should understand, there's a big difference between N95 masks, which is the big shipment that just came in on the Patriots plane from China yesterday. Those are really designed for healthcare workers, and it protects them as well as the patients that they work with. The other masks are called surgical and procedural masks, and some of them are homemade. They're usually made out of cloth. They are not designed to protect the wearer. They are, however, able to give some protection to people that are directly in contact with the person wearing the mask, since coughing and sneezing, at least to a large extent, would be trapped inside the mask and would not become airborne. So it's important you know the difference between those kinds of masks. The CDC is currently attempting to decide if they should recommend that everyone wear masks instead of just people that only display symptoms of this disease. That could be a very positive idea. You may have seen all the people in China and South Korea that seem to be all wearing these masks at all times when they're out with other people, simply because if everyone is wearing these masks, that means that they're all protecting other people from getting infections from the person wearing the mask. So that's a positive as well. In terms of the gloves, there's different kinds of gloves. I've seen people wearing winter gloves. I've seen people wearing a variety of disposable plastic gloves, some of them made of latex. And if they're made of latex, some people actually have an allergic response to those latex gloves. Others are actually made of something called blue nitrile, and those generally do not have any kind of allergic response. And because I used to teach microbiology laboratory, and I've done this more times than I can even start to remember with my classes, I'd like to demonstrate for you the proper technique for removing these after you've used them and you don't want to touch the outside surface of the glass. So here are nitrile gloves. If you imagine these have now been in contact with something that might contain viruses, they would be on the outside of the gloves and mostly on the bottom of the hands. If I now want to get rid of these, the safe way to do it is to use one glove and actually grab at the wrist and pull the glove off so it becomes inside out. So the virus particles, if they're there, are still on the outside of the glove, but they're now on the inside. You can then use your other hand, which is now no longer gloved, and you can do the same thing and pull the other one off, but you notice that, again, it's now inside out. The question is now, what do I do with these? If you're working in a laboratory, you dispose them in biohazardous waste containers. We can't do that here in Plymouth. So what you need to do is to make sure that these are discarded in the trash. Do not, please do not, leave them in shopping carts where they might come in contact with other people. So I love to do show and tell because it's my educational background, and I hope you'll remember that you should really do that. Finally, just a big shout out to the big Patriots' ability to bring back so many N95 masks to all of our health workers that really need them very desperately. And thank you very much, Steve. I'll turn it back to you.
Thank you, Dr. Barry Potvin. He is a member of the Board of Health. Certainly, when he shows us and he tells us, it's very helpful. These basic things with masks and gloves, we get these questions often. And now we're going to go to Amy Naples. She's the Executive Director for the Plymouth Area Chamber of Commerce. Welcome, Amy.
Hey, Steve. Good afternoon, everybody. Our business update today. I think everybody is aware of the relief programs through the CARES Act, the two programs that are available at this time, but I did want to do a quick overview of those. The Economic Injury Disaster Loan administered by the SBA is available for small businesses, sole proprietors, independent contractors, and nonprofits with less than 500 employees. There's also a bridge loan of $10,000 to cover expenses. You can apply for those loans at sba.gov, and those loans are available now. All the buzz today is the PPP, which is the Paycheck Protection Program, which is also backed by the SBA, however, through your local lender. Small businesses with less than 500 employees, nonprofits, sole proprietors, and self-employed can apply. The Treasury stated it goes live today, and small businesses and nonprofits can apply today. However, independent contractors and the self-employed are available to apply on April 10th through your SBA local lender. So be sure to talk to your business banker or accountant to discuss the best course of action for your business. But please, I do want to note, be patient with your bankers, as this is new and all the banks are in the same position, trying to get a process in place to handle the high volume while maintaining compliance. The Chamber is working hard to educate our local business community, educating ourselves and about all of the programs available. We'll be offering a series of webinars on various topics that are very important to your business during this time. You can sign up for our emails through the Chamber's website, plymouthchamber.com, or you can certainly like us on Facebook, and you'll learn more all about our virtual programming. Last night, we had a great virtual happy hour networking meeting, and we had a lot of fun connecting with people. So each Wednesday morning and Thursday night, we'll be hosting virtual networking. Members and non-members are welcome to join us. It gives us an opportunity to connect with fellow business owners, colleagues, and members of our community during this time of isolation. And we as a chamber feel it's so important to stay engaged for you and your business. So certainly feel free to join us at those opportunities. One thing I think is really important for us all to learn during this time is to communicate. Connect with fellow business owners, be transparent about your concerns, your challenges. You just never know how they're going to be able to help you. And as always, I'd like to let you know how you can support small businesses during this time. You can purchase gift cards, order takeout, schedule routine services. But another way you could also do so is to leave a positive review on a Google page for those small businesses. And that is the business update for today.
Thank you. That was Amy Naples. She's the Executive Director for the Plymouth Area Chamber of Commerce. And now each day we get an update from the state, from Matthew Muratore. He is the Plymouth State Representative. Welcome, Matt.
Thanks, Steve, so much. Great guest on today, too. We appreciate all the comments. I'm actually going to follow up a little bit on what all the good comments Barry had to say as well. First of all, as Barry indicated, the governor has closed all beaches as of today, April 3rd at noontime. So those are all closed for parking. But that doesn't mean people shouldn't be able to go outside to get some fresh air, and as long as you stay within the social distancing and no more gatherings of 10 people. So that has occurred as of noontime today. And just go back on some of the numbers that Barry was talking about as well. With the amount of people in the Commonwealth, I want to put this in perspective for people. There are 7 million people in the Commonwealth. Okay, so at this point, and yesterday was the largest number of increases in the virus for people that we've had so far, and that surge is going to continue. That will continue. But out of the 7 million, there's been 56,608 that have been tested. And out of those tested, 16% of those, or 8,966, almost 9,000 people, have actually contacted the virus. Presently, 813 are now hospitalized. And of those 8,966, we've had 154 deaths, or about a little less than 2% of those. In Plymouth County, it's 621 people have contacted the virus, and 34 in the town of Plymouth. As Barry was talking about the modeling that the governor is talking about, that model is going to look something like somewhere between 47,000 and 172,000 people in Massachusetts will contract the virus. And that model is showing somewhere between 700 and 2,500 people who will die from the virus. And putting that in perspective, it'll be around 1 to 1.5% of the entire population of the Commonwealth. So just want to make sure people understand those numbers, and we'll continue to give those numbers updated every day that we're on. Interesting to note that a week ago, the number of deaths were at 35, and we are now up to 154. And again, the modeling is showing that we could reach somewhere between 700 and 2,500 over the next 2 to 3 weeks of the surge that we're anticipating. In anticipation of the surge, the Commonwealth is looking at various parts of the state, particularly long-term care facilities that have closed in recent years, to open back up to help hospitals. So they are looking from the Cape Cod to the Berkshires and everywhere in between to do that. So that is happening. With regard to long-term care facilities and our nursing home patients, residents, at this point, there are 197 folks in nursing homes that have contracted the virus, and that's 84 nursing homes are part of that. So there is a concerted effort now with the National Guard involved in nursing facilities to be testing all residents in nursing. And when I talk about long-term care, I'm talking about nursing homes, assisted livings, and rest homes, which total about 700 facilities in the entire state. So we are looking to test all those folks with the national help of the National Guard, as well as folks that work at these places as well. I know there was a question that came up from one of the commissioners, Russ Shirley from the Housing Authority, looking for public housing testing. At this point, that is not in play, but doesn't mean that won't get there at some point. But this is where the priority is at this point. But of course, everyone should, if they are feeling ill, they should contact a healthcare provider or go on buoy.com to see if you have the symptoms before you call your healthcare provider. So I just want to make sure we got those numbers in perspective. Also, there are several sites on mass.gov to look at that will help this whole epidemic that's going on. There are sites that if you want to donate or sell any products that you may have, the PPE, the personal protective equipment, there's a site for that. If you are a retired person or somebody looking to volunteer that has a healthcare background to assist in public health or healthcare or any sort of emergency response, there is a website for you to sign up for that. So please check out these websites that are on mass.gov. And if you can help in any way, please do so. Yesterday, the House and the Senate have finalized a couple of bills that I want to highlight some of the items. It's on the governor's desk as we speak, and he's expected to sign it today. And by the way, the governor will be speaking today at 1:30. Some of the items extend town meeting beyond June 30th. It needs to go beyond June 30th. And towns will be allowed to continue operating budgets using monthly interim budgets funded by free cash or other revenues as approved by the Department of Revenue. The income tax, which I know a lot of people have been asking about, the income tax has now delayed. Once he signs it, will be delayed to July 15th in the state of Massachusetts. Once the governor signs this bill today, beer and wine will be able to be sold for takeouts at restaurants that have a beer and wine license. And there are restrictions at the amount that they can actually give with a meal, but it does have to be with a meal. So that's happening. The deficits that occur because of the COVID-19 by communities will be allowed to be amortized over 3 years. So that's important for communities to know that. Public employees who have retired, and there's an annual cap on their earnings and hours, that is being lifted under this bill, under these bills that are coming out, this governor will sign today, to allow those folks to actually come back and help where needed. Deadlines on property tax. We've been getting this question a lot. Again, by approval of the town will be June 1st. So they can push that back to June 1st if they elect to. There'll also be some language about waiving penalties and interest payments for late payments that also include water and sewer bills as well, as long as payments are made before June 30th. And there are also a lot of language in this bill about variances and permits and special permits and license and amendments and extensions. Some items that Lee Hartman, our director of planning, talked about earlier in the week that will be a lot clearer once this bill is signed by the governor. And finally, in this, if you are a nonprofit or a public corporation, you'll be allowed to conduct remote meetings. In a lot of cases, you can't do that, but now they will be able to do that. There's a couple more bills that we're working on today and into the weekend and hopefully by Monday. One is a bill that will look at a moratorium on evictions and foreclosures to prevent renters and homeowners from being evicted or foreclosed on during this period. So we hope that will come to fruition early next week. I know Dr. Campbell has been doing a great job with Dr. Maestas and the school system on really trying to get our kids learning and hopefully getting them back to school. And one of the bills that we're working on is to relaxing the MCAS. I talked to a number of teachers over the last couple of days, and they're concerned about having to come back and do the MCAS. So there is a bill out there looking to relax the requirements of the MCAS. So we'll look forward to that next week as well. And finally, unemployment, as we talked earlier in the week, the unemployment numbers they're actually the highest they have been since 1975 now, and they're growing leaps and bounds. So the expansion of the health unemployment benefits is another bill that's being looked at by the House and the Senate, and we should have some language around that to hopefully by the early part as well. And that is the update for today.
Thank you. Matthew Muratore, Plymouth State Representative, providing a state update. You can send your questions to plymouthinfo@pactv.org. We've also been in regular contact with our local hospital, and today they indicated that the Long Pond Road blood drawing station is open for appointments. That's at 110 Long Pond Road, is accepting appointments for patient convenience and safety during the COVID-19 crisis. And it's open from Monday to Friday from 7:30 to 3:30. And to schedule an appointment, call 508-830-2466. And if you're reaching it after hours, they'll return the call the next morning. The patient and the staff safety is paramount. Anyone entering the drawing station will be screened for COVID-19 symptoms. Matt Muratore, further comments?
Yeah, thank you, Steve. It reminded me of something too. This morning we got a call from the hospital looking for places for.
I believe we lost.
Yeah, the governor's looking for very responsible.
Yeah,
Can
Matt.
you hear me?
Go ahead, Matt. Go ahead. We lost you for a moment.
Okay, so as I said earlier, we are looking for places to put elderly people that from nursing homes, these other open buildings in the Commonwealth. Also, the hospitals are looking, as part of this surge and getting prepared, they are looking for hotel motels to use for beds for sick people. Some will be for non-COVID related, others will be for COVID related. In Plymouth, we got a call from the hospital this morning, and thank you to Amy Naples from the chamber and Keela Small from the Comfort Inn. They were very helpful and instrumental in getting the hotel motel community together and getting some resources to the BID Plymouth this morning. And they're working as we speak to try to find a couple of these places to help out. So kudos to them. And it just shows what an amazing community and how we all come together so well.
Thank you, Representative Matthew Muratore, Plymouth State Representative. We're now, just before we go to our Q&A, again, your questions to plymouth.info@pactv.org. And want to let you know tomorrow's lineup, joining Ken Tavares, Matt Muratore, and me will be Michael Jackman, and he is representing Congressman Keating's office. Also, Michelle Brady, she is the Director of Elder Services, and I'll also be reporting on the Mass Moderators Association Representative Town Meeting Moderators Zoom meeting, which will be held tomorrow morning, and share any information that I receive from moderators around the state. And at this time, we're going to begin with our questions. We're first going to go back to Dr. Christopher Campbell. He is the Assistant Superintendent of Plymouth Public Schools. Chris, the question is, how is Plymouth supporting our food-deprived families? Dr. Campbell.
Thank you, Steve. Excellent question. Yes, thank you. Can you hear me? Great. So thank you. Excellent question. So as soon as we decided to close our schools on March 13th, we knew we needed a plan to address our children and families. I'm getting a lot of feedback. Can you hear me?
We can hear you. Continue.
Okay, great. So as soon as we decided to close our schools on March 13th, we knew we needed a plan to address the children and families that were food deprived during the closure. We had a meeting on March 16th with the South Shore Community Action Council, as well as our food service director and volunteers, to develop a campaign to seek volunteers for food donations, deliveries, and distribution. I need to emphasize one particular person who has been invaluable to me and this community through this process for us, and that's Lisa Adams. Lisa Adams has stepped up and volunteered to coordinate everything that we're currently doing. We now have over 80 volunteers collecting food, bagging weekly meals for children, distributing and delivering. So it's amazing. And I also want to thank the Plymouth Education Foundation for their generous donations, which has allowed us to provide and purchase thousands of dollars of additional food for children. So we continue to provide free breakfast and lunch to any child under 18 at Hedge and Indian Brook, Monday through Friday from 11 to 12. We're also providing to-go bags from 9:30 to 12:30 on Fridays at these locations with enough food to feed a child for a week. So for those who can't get to Hedge or Indian Brook, we're arranging deliveries of bags to homes through the support of those volunteers. So families may go on our website to complete a request form by Wednesday of each week for the Friday delivery if they haven't already. But we continue to do that through the generous support of the 80 volunteers that I mentioned. So if anyone needs assistance, food assistance, and would like to, or like assistance in our efforts and to volunteer, please contact at food@plymouth.k12.ma.us. And I'm going to just put it up here on the site in my camera. I hope you can see that. It's very low tech, but food@plymouth.k12.ma.us. So we're doing as much as we can. We're making 300 to 400 meals at a time, and we're just, again, just tremendous support of this community. And I can't say enough for how appreciative I am to live in this town and to see the great work that our volunteers and teachers and everyone else are doing to help to feed our children and our families.
Dr. Campbell, one additional question for you. A viewer writes, the governor lifted the 180-day requirement for schools, so why are we adding days at the end of the school year? Dr. Campbell.
Yes, so that's a good question. So the governor did lift the 180-day rule. The only condition on there right now is that we were to add, we build in 5 weather-related days every year. That is a condition that we have done for the 20 plus years that I've been in education. And that's something that we do as districts in the Commonwealth of Massachusetts. So those are built in to our days. So our calendar currently goes through 185 days. or June 25th in our situation. So while we're not making up those days and we won't reach 180 days officially of school, we are required to provide 5 days beyond our original closure day, which brings us to June 25th.
We're next, thank you. That was Dr. Christopher Campbell. He is the Assistant Superintendent, Plymouth Public Schools. We're now going to go to Town Clerk Lawrence Pizer, and we have a viewer question. And the question is, I didn't receive my census form. How do I get one? The viewer didn't clarify whether it was the Plymouth census or the federal. And I know tomorrow we have the Congressman's office with us, but Mr. Pizer, as it relates to Plymouth, how would you respond?
The best thing to do is to go onto the website. There's a place to message me. Put that on a request, and when we return to town hall, we will get a census form to anyone who wants one.
Thank you, Town Clerk Lawrence Pizer. We're going to go to Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. Amy, our viewer asks, can a small business who is not a chamber member participate in webinars, and if so, how?
Absolutely. We are in the business to help businesses. So certainly any members or non-members are welcome to participate in our webinars. They can find the information on our website, PlymouthChamber.com, or through our Facebook page, which is just Plymouth Area Chamber. Or if they would like to start receiving emails, they can go to our website and sign up for those emails.
Thank you. And each day we go back to each of our participants for their final thoughts. What takeaway message would you like to leave with the viewers? We're going to begin with Dr. Barry Potvin. He is a member of the Plymouth Board of Health. Barry, what would you like members to remember?
Thank you, Steve. Well, a couple of things. One is that you may not know, but many of you probably do, Passover begins on Wednesday evening at sundown. It's very important to the Jewish community. And I thought it'd be appropriate at this time to just give a message to everyone, but especially all of our Jewish friends, neighbors, and colleagues. And that message is, may you all be blessed with happiness, prosperity, peace, and especially good health on Pesach and always. And finally, I'd also like to mention one more thing, and this comes straight from the heart. Keep in mind through all of this, no virus can defeat us, because together we are 64,000 Plymouth strong. Thank you, Steve.
Thank you. That's Dr. Barry Potvin. He is a member of the Plymouth Board of Health. Good words to remember. As we move on to Dr. Christopher Campbell, Assistant Superintendent, Plymouth Public Schools. Your final thoughts? Dr. Campbell.
Thank you, Steve. I just want to stress that we're here for our families. We realize that everyone's going through extraordinary circumstances. When our schools are closed, our families are now dealing with work and life at home. So we're trying to make our learning experiences and our education as relevant and meaningful as we possibly can, while trying to balance the unique circumstances that each and every one of us are facing at home. So I just want to stress that we're here for all of our families, all of our students. Please, if you need anything, reach out to us, reach out to your principals, your teachers, reach out to me directly. We're here to support you. Lastly, I just can't stress enough how truly honored it is to work in a community that I happen to call home. Many people don't know, I've been a resident of Plymouth now for 21 years. My children attend these great schools. My oldest is a recent graduate and is a successful college student now due to the amazing teachers and the support that this community has given to him in our schools over the years. So I'm just amazed by the outpouring of support and the collective goodwill of our residents and our teachers. We're here for you. We realize that these are unprecedented times, and the great people of this community are helping us through these most challenging times. So we should all be proud. As Barry said, we should be proud to call ourselves Plymouth residents and call Plymouth home. So thank you.
Dr. Christopher Campbell, Assistant Superintendent, Plymouth Public Schools. And yesterday, we are proud to bring this to you every day. We'd like to draw to your attention that the daily forums are date stamped on the screen to ensure that you're getting up-to-the-date information. We're going back to Lawrence Pizer, Town Clerk. Larry, your final thoughts.
Yeah. Thank you. Our town manager has been working to protect town employees by severely limiting the amount of time that we can go to town hall. The result is that I'm very jealous of every task that I have, and I feel very bad when we can't provide the service that we used to be able to. The most important thing that I can do right now is to get the town nomination papers verified so that we can have a ballot and know who the candidates are going to be for the town election. And also the state nomination papers are going to have to be completed before May 4th because the deadline for getting them to the state comes then. So when other tasks like getting postage for town meeting books comes up, we're working on it. We're trying to come up with an efficient system, but we have to make different priorities from the ones that we had in the past. And I thank people for their patience.
Town Clerk Lawrence Pizer, moving to Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. Amy, what takeaway do you want to leave with viewers today?
So today I wanted to share some advice that my husband as a veteran always shares with me: adapt and overcome. Come up with an idea to keep your business going. It's a challenging time to do so, but come up with something creative, innovative, and it will really, truly help your business. Market that new service on your social media pages. Leverage the power of social media. There are more people on social media now than ever before. And certainly utilize those stories on your social media. 78% of your consumers are viewing those stories. So don't give up, because all of your hard work is absolutely worth it. And as always, if I can be of any assistance, don't hesitate to reach out at 508-830-1620 or by email amy@plymouthchamber.com. And I just want to thank all of our panelists who are here today supporting our community on all fronts. We are such a strong community because of their great leadership. So distance socially, support locally.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. And we'll do a wrap-up with the state with Representative Matthew Muratore. Matt?
Thank you again, Steve, and again, panelists today. Once again, there is information out there. If you have questions, you can contact my office. There's state resources 211. Get text updates from 88877 COVID-MA, mass.gov/COVID-19, buoy.com/mass. There's a lot of resources out there. Please reach out if you have any questions whatsoever. And as I say every day, stay calm, stay informed. The more we come together by being apart, the quicker we'll get back to the people we love and the things we love to do. And thank you again, Steve, at PAC TV, for what you're doing. Again, all the essential workers that are out there support.
Thank you, Representative Matthew Muratore. We'll now return to Kenneth Tavares, Chair of the Plymouth Board of Selectmen, for his closing comments.
Thank you, Steve. This certainly has been a challenging week, but we're meeting those challenges head on, and I am so proud of this community. You've used a great deal of common sense. You're thinking through all of the actions that you're taking, and this is going to help in the final analysis. Thank you for what you're doing as a community. Together, we will defeat this. Thank you.
Thank you. That's Kenneth Tavares, Chair of the Plymouth Board of Selectmen. Each day he joins me and Representative Matthew Muratore. Today's guest, we want to thank Dr. Christopher Campbell. He is the Assistant Superintendent, Plymouth Public Schools. Also, Lawrence Pizer, the Plymouth Town Clerk. Dr. Barry Potvin, Plymouth Board of Health member. Amy Naples, Executive Director for the Plymouth Area Chamber of Commerce. Please join us again tomorrow, Saturday, at noon, when Ken, Matt, and I will be joined by Michael Japman, and he is a representative from the office of Congressman Keating. Also, Michelle Brady, she is the Director of Elder Affairs. You can watch us each day, Monday through Saturday, at noon at PAC TV. I am Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.